Sorry.
Now you have time to go.
I'm Rebecca Garber, a special education program support teacher and transition specialist for the School District of Janesville. And we are partnering with Tim to do Transition Talks Tuesday. And we get the pleasure of hearing from him and his son Hunter, and we're going to be hearing about healthcare and the transition that comes along with turning an adult and managing your own healthcare. So I will turn it over to you two and we'll get started.
Thank you, Rebecca. We're going to go ahead and share a PowerPoint, and we'll have all the introductions that you could possibly need, probably more than you would like, within that. So just give me 1 second. Okay, are you seeing the screen? Hang on.
Yes, yes,
Yes,
we are.
you are. Are you seeing the presenter view or the other view?
Presenter view.
Yes, you are. Because I need to change that.
This is the part where we have fun trying to figure out where to go.
Well, it's a matter of, so that is the presenter view, blah, blah, blah. So I'm thinking it's somewhere over here.
Yep.
No, it's not.
No. Okay.
Hmm.
Oh, so that is.
Okay.
So are they seeing the PowerPoint or the other thing?
We're just seeing the other thing. Do you click from on the far left where it says from beginning?
There we go. That better.
There we go.
So some days this feels like a Wednesday, some days it feels like a Monday. It's just the way it goes. Yeah, I don't know why I missed that simple step, but thank you for being there, Rebecca. So we are going to talk about getting ready for healthcare as an adult. I do want to warn people who like consistency and coherence, that you may be a little distracted by the PowerPoint today. I used to do this presentation. We used to do this presentation with a previous project called the Youth Health Transition Initiative, known as YETI. YETI had a beautiful color scheme that included the color purple, one of my favorite colors. And so all of our slides were branded YETI with the YETI colors.
You also put the abominable snowman in there from time to time originally.
Yes, because I wanted people to count the Yetis. We are with a new project now called the Wisconsin Autism Transition Demonstration Project, which I'll explain in a moment, affectionately called WATI. And I have yet to find a creature that looks like a Wadi. So there's no looking for Waddies.
I mean, you could put the state bird or the state themselves in cute little
I
areas.
could, I could. So what I'm warning you though,
Or you could put Bucky.
I could.
Wait, Bucky? No, that's
So
Ohio.
I wanna know. Well, Bucky Badger. So
Oh, yes, yes, yes. No, no, yeah, no, I was thinking the Buckeyes from Ohio because you're originally from Ohio.
thank you. Can I continue?
Yes, you may continue.
Thank you. So what you're going to see in the PowerPoint slides is a combination of the Wisconsin Autism Transition Demonstration Project slide scheme and the Youth Health Transition Initiative slide scheme. So
But sadly, no
please
Yetis.
do not, no Yetis, do not get dizzy. So this is who we are. My name's Tim Markle. I'm parent of Hunter. I work with the Children's Resource South, and I'm the training and transition coordinator for the Wisconsin Autism Demonstration Project.
Wow, that is a long title.
I know. So I'll say Waddy from
Yes.
now on.
And as he said, my name is Hunter Markle. I am his 28-year-old son who is a self-advocate for those with autism, anxiety, and depression. I love primarily hard rock and heavy metal music, and my go-to D&D character is Monk for class, and then race is primarily either Dragonborn or human.
And what's your current job, 28-year-old?
My current job is a peer mentor in an organization known as Active, which is based out of Janesville.
Excellent. Do you like being a peer mentor?
I am loving it.
Cool. So let's talk a little bit about the Wadi Project. So WADI is a 5 year, and I'm going to go through these relatively quickly. If you have questions, please, my email's at the end. Please, please, please email me about the project. But if in here you have any interest in joining the WADI project, of being a part of it, getting updates, all those good things, please feel free to go to integratedtransition.wasteman.wisc.edu and there will be options to join the project. So we're a 5 year grant from the Health Resources Services Administration. We have had grants from HRSA, HRSA, the Health Resources Services Administration, going back to 2009. And so every time we get one, we build on the other one. This time there were only 12 grantees throughout the United States, four focusing on autism, seven on epilepsy. Obviously we are focusing on autism. It's in our name. It is a demonstration grant, and so we hope to what we learn in Janesville, we hope to spread especially to other like-sized cities throughout Wisconsin.
So Madison, Milwaukee,
No,
Green
no,
Bay.
Madison, Milwaukee are much bigger. We preferred the Janesville size.
Mm-hmm.
Green Bay, La Crosse.
Fond du Lac,
Those
Dodgeville.
those sort of sites. Dodgeville's a little smaller.
I'm still saying Dodgeville because they could be
That's
used
well,
in
I know,
it.
and you like people in Dodgeville, so
Well,
and Fenimore.
yeah, yeah,
Um,
I do.
so what we are doing is learning from and providing resources for families, specifically with autistic youth 13 to 26, with more challenging health or social needs who need more support than other young people. What our funders have said is that it does not appear the transition services in the system are working very well. We're not seeing good quality outcomes. Reports of good quality of life aren't there. Living meaningful lives aren't there. And so they've tasked us with helping the system work for people 13 to 26 with more challenging health or social needs and who need support. So
That
that's
is
what
a
we're
lot
going to
of
do.
problems that we are hoping to fix with these people's monies that are going to remain anonymous.
Correct. Well, no, it's our tax dollars. So it's through the federal government. But the people, yes, we are not saying anybody's names. Got
Right.
you. So our goal is to improve that quality of life and well-being for autistic youth and their families and caregivers because we know people grow up in the system of the family. We You can't normally separate those out. And specifically look at time 13 to 26 of transitioning from the child to adult systems. Some of the systems we hope to interact with include post-secondary education, inclusive post-secondary education, employment, community, independent living, and including healthcare, which is what we're going to talk about today.
That is a lot of people.
Absolutely. It's a very large ranging project.
Yep.
Want to remind everybody that we also are in partnership with the Children's Resource Center South, which is out of the Wasteman Center. If you have children birth through 21 who have special healthcare needs or disabilities, you are very free to reach out, or your professional who works with that population, reach out to the Children's Resource Center South with any questions you have. They will do their best to hook you up with resources, talk to you about what you already have going on in your life, and talk about what else may be out there for you to support you. If you're not joining us from the Southern Regional Center, which includes the awesome county of Rock, there is a regional resource center for you. There are 5 resource centers throughout Wisconsin. You don't need to know all their phone numbers. All you need to know is the number for Wisconsin Wayfinder. That will get you in touch with any one of the Children's Resource Centers, and that's 877 Whisk Way. And so please feel free to use that.
Why is our introduction in here twice?
Because I was fitzing with the whole PowerPoint right before we got here, there's our introduction again. Let's talk more about what is healthcare. Do you want to take this? You've been doing this
No,
so
you can
long.
begin because I'm still a little frustrated that you didn't clean up the PowerPoint
No,
before
I'm
this.
sorry about that. So when we talk about healthcare, what we're really talking about is getting ready for healthcare as an adult. There are changes that happen from the pediatric or the youth model of care, when you go see the doctor when you're under 18, to the model of healthcare that adults experience over 18. We're also looking at this time as the exciting time of the caregiver, me as a parent, moving out of the role of the primary decision maker for healthcare and moving the individual into the role of being the primary decision maker for healthcare. Now, we know disability occurs on a spectrum. And so
Very
these are
wide one.
right. So these are not hard and fast. These are our goals. And so it's going to be very dependent on the individual and again, that family system. Some cultures have a much closer enmeshed family system than other cultures. And
Yep.
so they'll look at this and say, well, we can incorporate some, or it's more than just one conversation between an individual and a parent. Maybe it's an individual and extended family members where decisions are made. And so please take what you learned today and appropriately give it into the cultural context that you find yourself in. So
Can
let
Or
I
try your
can I
best.
interrupt you for a second and just
Yes.
absolutely.
I need you to let somebody in who's in the waiting room. Nicole can.
Okay.
Okay.
I thought I opened up the door.
Yeah, I wonder if she's looking on the wrong. Becky, text her and tell her make sure she's on the current link.
I am unfortunately not showing anybody in the waiting room.
Wait, no, go
Okay.
back down. There's someone in not joined.
No,
No,
no, that's just
just a guest. Huh.
Okay. She
so
might
yeah,
be in the
I
old link. So
right. I
Yeah,
don't think she's in the right link, but thank
yeah.
you,
Thanks for
Rebecca.
letting
okay.
us know.
Yep,
And
thank you.
while I am here, Rebecca, oh, where'd you go?
Oh, she's there. Keep going. There we go.
Okay. Um,
Did you need
while you are
something?
here,
We're making you co-host.
so now you can take care
Ah,
of any of those problems. My
okay.
bad.
Thank you.
All right. So let's give you a brief overview of the three parts of healthcare transition. You ready?
Yeah, as always.
Okay. So here we go. Down at your elbow is when we are born. How many decisions did you make on your own when you were born?
None.
Absolutely none. None of us do. We are born, we
The
are
only
here,
the only decision I made is when to cry and when to poop.
and that really
Oh, and
wasn't
sleep.
and that really wasn't a decision, was it?
No.
They're just things that you were naturally doing. So
Yes. But
if
I
you
chose to do it at the most annoying times.
sometimes, but if you were hungry, all you could do was cry. You couldn't like decide to get yourself something to eat.
Well, yes, because I didn't know how to crawl.
Right. And
And plus,
so
you guys wrapped me up tighter than a banana.
yeah, you were swaddled well.
Yeah.
So those decisions were all made by your mom and me and whoever was in charge.
Mostly mom.
Yeah. And so we made those decisions about when to change your diaper, when to
Yep.
feed you, what to
Yep.
feed you, when to take you to the doctor, what clothes you should wear, when you should leave the house, all those decisions made at birth. And then as you got older, we included you in some of that decision making because you need to learn. Everybody needs to learn how to make decisions.
Yep.
And so we started with what do you want to eat? Which with you and your semi-restricted diet was pizza
Yes.
and peanut butter,
Yep. Oh, and crackers
crackers
with butter on them.
and macaroni and cheese you eventually
Yep.
got to. But now you have an enormous palate. Okay.
Still selective, but yes.
Yeah. But you started to make those decisions. You made decisions about when you wanted to go outside. You started to make decisions about you could start to tell us when you felt sick, when you didn't feel good. You made decisions about what clothes you wanted to wear.
Hmm.
Okay. And then when you got closer and closer to teenage years, we started to talk about more decisions. Where did you want to go to school? You had great options of public school, online school, homeschool.
That's for a different topic.
I
And you
know, I
left out
know,
private.
I know, but it was your decision, right?
Most of the time, yes.
Yeah, we didn't make you do online schooling.
No.
You decided you wanted to do online schooling and you were at an age where you were able to make that decision.
Yep.
Up until this point, probably, we were probably still making most of your healthcare decisions.
Yep.
Okay. So then gradually, when you became a teenager and when everybody gets into there, we want to help build the skills to make your own healthcare decisions.
Hmm.
We want to give you knowledge to be able to make your own healthcare decisions.
But you did pretty all right.
Yeah, we did pretty all right. That's true. And then the responsibility to say, this is my health. I am a self-advocate for my health. My health is my determination how healthy I want to be.
Yep, which will be a minor story later on.
Exactly. And so we have all this time of preparation.
Hmm.
And then for everybody, and some people have primary care doctors, some have pediatricians as their primary care doctors, some have family medicine, some have specialists. You had a pediatric ophthalmologist
Yes.
involved in your life.
Yes, I did.
And so there's pediatric specialists, child specialists. And then at some point in our healthcare journey, are you supposed to do that part?
No,
Or am
no, no,
I?
you
Okay,
do
I'm
that
this part.
part.
Okay.
I'm the adult part.
There you go. The good point. We have the transfer of care where you're moving from that adolescent youth system into the adult system. And so this is going to be the adult system. This transfer of care is when, for instance, you may not be allowed to go to the children's hospital anymore. You have to go to the adult hospital. Your pediatrician says, I can't see you anymore. You need to see an adult provider. You can't see the pediatric endocrinologist if you have diabetes. You need to see the adult endocrinologist.
I
So
was
there
just
is
about to ask what the heck that
with
meant.
diabetes. So
Okay.
there's an actual transfer of the care from the child system to the adult system. What gets really confusing is depending on the youth, there may not just be one is your primary care doctor could change right at 18. Your pediatric endocrinologist may keep you until 22. Your cardiologist with your heart may keep you to 25. And so it gets really hard for families.
Wait, there's a specialist for kids with cardiac problems?
Yeah.
Oh,
And so
you learn something new every day.
it can get confusing for adults about when that transfer occurs. And that's where you really need to have the conversation here with your primary care doctor and with your pediatric specialist about when that transfer is going to occur.
Yep.
Because what happens after the transfer?
You're stuck in the adult world, everyone.
The adult specialists don't like it when we say stuck.
No, I mean just in general, like the specialists love us.
So, yes, the rest of life is included in the adult world. All this is preparation to succeed in here.
Or an attempt to succeed.
Right. Well, we want everybody to succeed as adults in
Yes.
healthcare. So
Oh, 100%.
that is the
Health is a very
overview
good point.
overview of what we are talking about when we're talking healthcare. So let's see where this might go in context. Brief timeline of what you can expect in transition in Wisconsin. You'll notice that some of these topics we're going to be talking about on Transition Talks Tuesdays.
Well, we're not going to be talking about the light blue one.
No, but we will be talking about the post-secondary transition plan involved in education. We'll hear from the Aging and Disability Resource Center. We'll be talking about supported decision making and guardianship, um, along with other topics that affect what happens in adulthood and preparing for adulthood. Well, in healthcare, we have a similar timeline. We ask, and not just us, but the medical organizations recommend that at the beginning of age 12, the doctor, the clinic, are talking with the youth and the family to make them aware of what their transition policy is.
Well,
Here
also
is,
hospital if they're seeing
right, if
specific
they're in the
specialists.
hospital. And so it's during here that these conversations about what's going to happen over here should be taking place, of laying out their policy about how that transition, that transfer of care is going to happen. At 14, begin building those skills, begin building those knowledge, encouraging self-determination and self-advocacy in the youth so that they will have practice in making those healthcare decisions before they become adults. That preparation continues at age 18, at age 16, and then transfer care at 18, sometimes between 18 and 22. Hopefully, by 23 to 26 years old, that youth is integrated into the adult healthcare world and is in the position of primary decision maker. And the parents, guardians, caregivers are then the supporters of the youth's healthcare. Again, this will vary by culture and it will vary by family makeup and by the young adults' abilities and the
Mhm.
young adults' choice about what decisions they feel comfortable making. So you're like, this sounds great, Tim. Right, Hunter? Doesn't this
Sounds
sound great?
awesome.
Sounds awesome. We've got partners like Got Transition out there.
Yep.
We have got people who know all sorts of great things about healthcare transition. There's
Yep.
a lot. We've been working on this for years. So,
About 6 or 7.
so let's see how we're doing, okay? So let's
And
see.
no, that was not meant to be the meme joke of 6, 7 if anyone
Oh my
has
God.
teenagers. I did not mean that type of joke. No, no, dear God,
At
no.
least you didn't do this while you said 6, 7.
I don't do the full meme. I just make the
Uh-huh.
joke about it.
Uh-huh.
Okay? Besides, 6, 9 is a better number anyway, to be
Stop,
fair.
stop, stop.
Okay, I'm stopping.
Ah. So how are we doing, Hunter?
We're doing better than nationwide at the very least.
We are. Wisconsin, according to
And
the
no, we're not talking about the insurance company.
Thank you, National Survey of Children's Health, a third of the people who responded to the national survey responded that yes, they have received preparation. They received the services to prepare for transition. Now, you'll notice that we are doing better for children with special health care needs. They are receiving a little bit of added support to make that transition. Our non-children and youth with special healthcare needs, the vast majority of students are not receiving any preparation to take charge of their own healthcare or very little. So we have a lot of room that we could do better with children and youth with special healthcare needs and disabilities and with children without special healthcare needs and disabilities. So when we think about healthcare transition, it's going to be one of the most inclusive areas that you think about because this system happens to everyone, every youth, every student. This is an inclusive system. We all end up in this 99.9% end up in this system.
Yep.
Okay. So
It's not a country club.
that's right. Let's talk a little bit about some parts of the system. So these are some of the areas that we think could be
Important transition tools to discuss.
exactly. And also that could then be talked about in different areas of transition.
Mhm.
All right. So let's talk a little bit about, I already mentioned this change from pediatric or family medicine, but especially pediatricians into adult providers.
Yep.
How did you find because you used to see a pediatrician.
I did up until like 14, 15 years old.
Yeah, around 15 years old. Do you want to tell the story or do you want to just continue on? It's up to you.
Well, the basics of it is that both my parents asked me and my pediatrician about being more one-on-one in talks with healthcare, and both of us did not understand the reason why. The pediatrician is an amazing doctor. I will say that right off the bat. I will never diss those within the healthcare community as they work hard and try their best, but sometimes they are at their limits when it comes to certain aspects. And the pediatrician, their aspect was understanding that the kids they are seeing are becoming teenagers and they didn't understand teenage to young adult healthcare systems and everything.
Mhm.
So we had to discuss how to find me a medical provider and doctor and everything that deals with young adults and teenagers more
And he also deals with,
regular adult.
yeah, and older adults.
Yes. Case in point, you. Because
Yes.
you decided to introduce me to your doctor.
Did you just call me old?
Dad, they can see your gray hair.
Okay. All right, just checking. So yeah, so you ended up, so our solution was I talked to my primary care doctor and his team and said, "Hey, this is my son. I want to describe him to him with his autism. This is how he learns best. This is the conflicts that we're having.
Well, I wasn't
Would
diagnosed
you
with autism until I was in my early 20s.
you were not medically correct. You were not diagnosed with autism to your early 20s, but you had some barriers,
Yes, I
challenges
was.
before then.
considered a slow learner
Hmm.
and had anxiety, stress, the usual young teenager stuff.
Along with an educational assessment of autism.
Yes, yes.
Um, so that's how we introduced you because we fell into the trap that many parents did, is we got very used to going into the doctor and having the doctor ask us how our kid was doing, and us having a conversation with the doctor, with Hunter just sort of being in the room. And so we got to the point where they would ask me a question and I would just turn to Hunter and go, "So how you doing?"
I'm okay.
"Yeah." And he'd answer, "I'm okay." And so our choice was to introduce him to my doctor because I really appreciate my doctor. Do you
Oh,
like
I
your
love my
adult?
current
What do
doctor.
you like about the adult provider? What's important to you?
The fact that they dumb down all the medical terminology. They are straight to the point in appointments at times. They laugh at my jokes and are really good overall human beings and see me for me
Awesome.
and not just a number.
And
Though those doctors that do see their patients and numbers are also amazing doctors. Again, never going to diss anyone within the healthcare community.
and I know the other thing you've talked about is how your doctors, your medical team listens to you
Yep,
and how you feel very welcome to ask questions if you don't
yep,
understand anything.
yep,
So the other areas that people find adult providers are by talking to other parents, but the main point is to talk to your primary care doctor about who's going to provide the care or how is that care going to be provided when your child turns adults. Same conversation with specialists is who's going to see my who's what specialist does my child need to see when they become an adult, and working on setting all those things up.
yep.
Let's talk a little bit about decision making.
Hmm.
What did you decide? How did you decide you wanted to make decisions in your adult life?
Well, the primary one, which is going to be very basic and very quick, was when I decided to go 2 weeks into St. Mary's mental health ward and everything. Best decision I ever made for my mental health and everything. And I am very proud of making that major decision.
And it was a decision that was a conversation that I was not very encouraging
No, you are
about
not.
you going inpatient because
No.
I had a lot of fear.
Hmm?
I wanted to take back control of your health care and say, no, 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 I know what's best for you. And you stuck to your guns.
I stuck to my guns and basically laid out every reason why I needed to go in. And you let go, and this was again the best and biggest decision I have ever made. And if you are wondering why I'm being very vague, it is because it is a very high trigger word and
Hmm.
everything for a lot of people,
And we didn't do any warning, did
and we
we?
did not do any
You're
warning
correct.
about it. So I will just continue saying mental health problem,
Hmm.
and you can take any indication towards what I mean and everything from that.
So that was an example where you took medical decision making.
Yes.
Another example is with your medication. So after that
Hmm.
stay, you were given an antidepressant and you
Correct.
were placed on an antidepressant. And then what happened?
I then promptly forgot to refill it. Survived COVID off of my antidepressant, which is in a miracle of itself because if everyone knows what the COVID year was like, you would understand why that is a miracle for an autistic individual
Yeah,
and everything.
you survived very well.
Yep.
And
And then recently I got back on it, a bit of a stronger one that was explained to me. Well, I explained to my primary care doctor about why I wanted a bit of a stronger one and one that felt like that's like a numbing antidepressant and more of one that does its job, but I keep my personality.
and that's what you've been on now for a little while.
I've been on that since about 2020, April of 2024, I believe.
And so one of the changes that I want to bring up is that I know that you came and talked with us.
Yes.
You explained why you wanted to go back on your antidepressant, but it was very clear it's your choice.
Yep.
You get to make that decision. And so
Yep.
you did. And that's how we try to do healthcare, finances, housing, employment. You're the decision maker,
Mm-hmm.
but we are here for you to talk with, to talk through, look at the pluses, look at the minuses, collaborate, share in
Mm-hmm.
that decision making, but you are the primary decision maker.
Yes.
All right.
Though I wish we had that discussion with health insurance when it was my sister off in college.
What happened with her?
She found a doctor after a minor accident and everything, and she was worried about potential injuries from said accident. Very minor injuries, but she found one that was out of network with health insurance and had to pay a pretty sizable amount of money for it.
And so you learned about the difference between in-network and out-of-network
Yes,
of health insurance.
yes, and she learned the slightly harder way.
And learned the slightly harder way. So,
Sadly, her wallet was the price.
so
Luckily, she graduated college without any debt, which
she did. She did.
is amazing.
And so that whole teaching about health insurance, how to use health insurance, the ins and outs of health insurance are also one of those knowledge steps
Mhm.
that can be taken during the preparation
Yep.
phase.
And all the numbers on the card from parents who are part of the same health insurance, if
Hmm.
said young adult and teenager is a part of their family's health insurance or not, but they still have it on the card for emergency contact and everything, because sometimes it's like the phone is destroyed, let's check their wallet. They have a health insurance card.
Hmm.
It's not a health insurance that's attached to the parents, but the
It may
parents'
not
numbers
be.
are still on the card because
Hmm.
it is that whole idea of, okay, emergency contact, health insurance
Hmm.
card, let's see what's on there.
And the phone is where students are now saving that
Hmm.
emergency contact information. So you could download, you could put that emergency contact because paramedics and first responders are looking at phones as much as they're looking for wallets and
Yep.
for cards. And so it's really important to learn how to get emergency contacts from the phone.
Yep. And also on the health insurance would be the on-call nurse, the
Hmm.
phone number for their primary insurance bill, and
You really did
holder.
memorize your insurance card,
Is
didn't
it?
you? When I said learn what's on your insurance card, you took
It,
that to heart.
yes, I kind of did take it too hard a little bit.
Yeah, so looking over that insurance card and saying, "Hey, look at all this information. Look at all these
There is a
resources.
good
Look
amount
at
of
all the
information on
supports."
those. Yep. The one thing that it doesn't help you with is appointments.
So, how did you learn how to make your own medical appointments?
Trial and error, and a lot of walking out of the room after answering the basic questions.
So, back in the day, we used phones and
Yeah,
they were connected
not
in
not not
umbilical
like these
cord.
fancy ones.
Right. They were
They were the
somehow
old
connected
school
to the house.
landline or the landline home phone without the actual line into the wall.
Yeah. And so we taught you, they're probably going to ask your name.
Yep.
What else are they going to ask you?
Date of birth, address, zip code.
Hmm. What's your insurance?
Yep.
And why are you calling me? What do you want to see the doctor about?
Yep.
And so we would coach you along that as you would make appointments
Hmm.
based on when you wanted to see the doctor and when we thought you needed to see the doctor.
Yep.
How do you make your appointments now? Because I have not made an appointment for you in years.
Through a wonderful thing known as SSM Health, My Chart nowadays and everything, because everything is now digital. It has been fully digitized and it is awesome and I love it. Less phone calls, please, and thank you.
And we already talked a little bit about medications,
Mhm.
but understanding what medications you take, what they are supposed to do, so you know when they're not working, what maybe some of the side effects are.
And what
But
not to take them along with.
yes, yeah, that fancy word, contraindications.
Yes.
What not to do or what not to take as you're armed as medicine is really important. Or for a lot of youth, it's learning about alcohol intake and how
Hmm.
that's going to affect the medications that I'm on.
Yep.
How will smoking affect the medications that I'm,
Vaping. You
or
meant
vaping,
vaping.
sorry,
You meant
vaping,
vaping.
right, meant vaping.
Yeah.
But those, what's going to happen if I do these things with the medications that I'm on?
Yep.
And then what you
Is
now
there
do
a
alone,
specific card that I need to purchase this medication in case of, again, medical marijuana and everything is the one that I'm primarily thinking of, is they have special cards for that medication.
you know more about medical marijuana than I do. Congratulations. You are now a step ahead of me.
I mostly
Uh,
they the internet and TV shows for that one.
But how do you refill a medication?
I nowadays refill it through a wonderful app that I found that is connected to the local pharmacy here in Stoughton.
So you now don't have to pick up the phone and call
Nope.
anyone, do you?
Nope. I
No,
just need
no.
to enter the basics of what medication I need refilled, and they will have it.
And what's awesome about that is if he has struggles with that, it's not, please wait, hold on, I'll be right back to you. He can bring me to his computer and we can sit there and go through it together so
Yep.
that he is learning as I'm teaching and I'm learning as he's teaching. So that really has been a benefit.
Oh, it has been an amazing benefit.
And so you also at the end of this journey could receive a health summary
Hmm.
that could be a written report of this is my short health history, these are my medications, these are the main things that I'm working on, these are maybe my health goals. And we
These are my
encourage
previous
people,
specialists that I had as a younger child for such and such problem that is now fixed to the point where it's
yeah.
no longer impacting my adult health.
Now this is a
There's
summary, remember.
right, but
So we're
it's
not
we're
listing
not listing all of it,
all
but
those
sometimes it
people.
is a part of it and everything.
The
Just
ones that
the
are on ongoing,
right,
absolutely correct. But the point is that it's a summary.
right.
It's not your entire health record because your
No,
entire health record is contained in your medical record.
yes,
But you may go somewhere where they can't access your electronic record.
true.
So you're going to want this short 2, 3, 4 page summary
Hmm.
of your health condition so that if you end up in an emergency room that's not connected to your healthcare system, that you could say, this is the stuff you need to know about me so
Yep,
that you can treat me well.
yep. Which is also another thing is the whole thing of about me.
Yeah, what's important for doctors to understand?
Who the person they are, who the person they're talking to is, who their patient is, what to say, what not to say, what to touch, what not to touch, and subjects like that.
Yeah, what arm do I want a shot in? Do
Hmm.
I want small talk as I come into this, or do I want to get straight to the point because this is a medical appointment and I want to talk medical?
Yep,
And everybody's different.
yep,
So putting together a page of this is about me, this is how I want to be treated, this is what I want to be called, and having that given to your clinic before you go in for that appointment could help make the appointment go quicker and smoother
oh,
and with less
100%.
anxiety. All
Less
right.
anxiety is always a good thing.
Now I know we have many educators, and
Yes.
educators love assessments.
Oh dear God, do they?
Oh my gosh, they assess everything.
Yes.
So
Still wish we had this in a third language. When is that going to
I
happen?
don't know, but it's in English and Spanish, which is great. So our friends at Got Transition, which is a national resource center around healthcare transition, actually have readiness assessments. They've also developed readiness assessments specifically to incorporate goals into the individualized education plan and into the post-secondary transition plan. And so they have put together an assessment of such as I know who my doctors are. Yes, no, I need to learn this. And then write a goal 80% of the time. The student can identify who his doctor or his primary specialist, whatever the most important thing
Or her,
is, or her, in there as a
them
goal,
as well.
them as well.
We need to remember that.
And so we have a number of assessments are available. Along with then Got Transition also has sample goals already written for the IEP that could also be in the PTP. So for the rest of the time we have together, we want to go over briefly about how healthcare
Very briefly.
intersects, yes, very briefly, intersects with the other parts of life. because we know that we're transitioning not just health, we're transitioning school. We may be to getting a job for the first time. We may be getting a new job. We've got to decide who's making the decisions. How do my rights change
I am
when
just
I
going
become
to
an adult?
come on.
And then,
Why does chat not want to show up now?
okay, sorry,
Yeah, because sometimes we might have a few questions in chat to answer
we
really
might.
quick.
We'll get there at the end.
Yep,
Yes.
No
we
problem.
do have a question and then a
Great.
statement. So when we get to that, we'll go
Okay.
ahead.
Yep. Thank you, Rebecca.
Okay, yes, we will, Elena, we will have Hunter talk about that, about what his sort of where he was at.
Hmm.
Okay, fantastic. So we're going to go through these next few slides, then we're going to get to the awesome questions in chat. Well done. Um, the case I want to make is even in the midst of all the different transitions, is that healthcare, um,
Intersects literally everything as it is the linchpin to having a great life.
exactly. And so when we talk school and health, we know we'll learn more about the post-secondary transition plan. We know that healthcare goals can go into the post-secondary transition plan, into the IEP, as long, of course, as they are supportive of the educational attainment of what needs to happen to help learning occur for that student. It could be in a goal.
Yep. In high school, middle school, post-secondary, these are all areas where we can have these sort of discussions.
And you might also, depending on the child, have goals that have been set with the school nurse as an
Hmm.
individual health plan, which are basically healthcare goals, is it is a nursing care plan. And so they may also have individual health plans with the nurse. Some students have emergency care plans as well, what to do in case of emergency. All these things that have been done, maybe it's mental health. They've been seeing the school mental health support. Well, all these things at school are also going to come to an end. At some point, they're going to exit school. So, what needs to be carried forward for this student to continue to see when they go to school, when they go to college, when they go to trade school, when they go to an apprenticeship, when they go get a job, when they're living out in the community? What have we put in place that needs to follow along with the
Hmm.
student? Um, and especially when people go to post-secondary school, what was most important, one of the most important things that you figured out when you went to Madison Technical College?
The Disability Resource Center within MATC.
Yeah, so most colleges have disability resource centers to support students with disabilities going to college. And so that's one of the most important people that you can check in with.
Yep.
We'll get these slides posted. There are a number of different resources to help you navigate through school and
Yep.
navigate school and health. Employment and health is also an area.
Hmm.
Is like, when did you know you've had a few jobs now?
One, two, about 4 to 5.
4 to 5 jobs, maybe not with this one because pure
No.
metric's kind of
Human
obvious that you're
is my newest
disclosing,
one,
right. So
yes.
you're disclosing that you had autism because you wanted
Yep.
to be a peer mentor
Yep.
around autism. But in your previous job, when did you let your employer know that you're autistic?
Usually I let them know about, depending on the supervisor, I either let them know a couple days into it or exactly at the point of starting the job and everything and meeting them for the first time.
And there's no right or wrong answer
There's no right or wrong answer. And you
as to
may
when
not
you
want to
disclose. That was what you
right.
chose to do. That
And
was
sometimes
your
you might not
choice.
want to disclose at all out of fear, out of stigma towards being an individual with autism or with ADHD or with AU ADHD.
And without disclosure, though, you can't get accommodations.
Right.
And so this is the balance that
Hmm.
people with disabilities have to do.
Yep.
And it's all about, what do I need to maintain those accommodations, help me maintain my
Hmm.
mental health.
Yep.
And so we look at those accommodations, and how am I going to talk about that disclosure?
Hmm.
How am I going to talk about, maybe I need a constant source of water, maybe I need multiple breaks during the day.
Yep.
All these things that are health related, along with the question of, I know when, well, you went to homeschool, but when Sammy went to the brick and mortar school,
Yes.
if she was sick, we called the school and let them know that she wasn't going to be at school.
Hmm.
I have yet to call your employer to tell them you're not coming into work.
No, I am primarily the one that contacts them. And again, all the slides will be posted and everything. So these are the amazing
And
website
sent.
and sent and everything. So again, website links will be available on the slides. Housing and life, that is just usually either an apartment complex, dormitory, your own house, an RV, even possibly a tent somewhere in the park. You still
Sure.
need to have good health.
Yes. And
Hopefully, you are
where
not
you,
living in a tent with good
hopefully
internet.
not. But you have to think that if I have health concerns,
Mhm.
where I live could impact where how often I need to get to the doctor.
Right?
So if I'm going to need to get to the doctor quite often, I need to make sure I'm living somewhere where
Hmm.
I have transportation to get to
Yeah.
my healthcare provider.
Yes.
That I think about how am I going to get to work?
Mm.
How am I going to get to maybe part of my mental health is being outside.
1 minute till we have 10 minutes left, by the
Okay,
way.
thank you.
Because again, I want to leave time to answer the amazing questions from the amazing people.
Absolutely. So
And yes, Rebecca, you are a part of those amazing people.
we'll wrap it. I will wrap this up.
Yes.
Okay.
And so I am just
So
going to jump to the
well,
website.
I just want to mention, oh yeah, go ahead
Yeah.
to the websites. So there are some websites. NAMI, Wisconsin has a Finding Stable Housing website. There's an Improving Transportation for Non-Drivers. And what I was really excited about is because we also have to remember that our kiddos, our young adults and adults with mental health may also have issues with addiction and recovery. And so it's really important that if they need to go in for recovery, that they can find someplace that is accepting of neurodivergence, built for neurodivergence. So please, unfortunately, disability is not a protective factor
No.
for addiction. And so we need to keep that in mind as
Yeah,
well.
we covered most of that earlier with rights and decision making. We did not cover guardianship or supported decision making,
We're
but
going to talk about that later in Transition Talk
yes.
Tuesdays. But we do have some slides if you want to get a preview. We do excellent resources from Board for People with Developmental Disabilities, along with Family Voice of Wisconsin. So now, right into the chat, how you're going to bring healthcare into your area. We aren't going to talk about this right now. If we have time at the end, we will. But now you have an overview of what healthcare transition is, how it intersects with a number of different areas of transition. So now it's your turn to think about how it fits for you. Where does healthcare intersect with wherever you are as a parent, as an educator, as a county worker, as a state worker, as a medical personnel, maybe a DVR job counselor, all those different things.
Yep, and
And
you accidentally
then,
covered
oh,
the arrow
I
with
did
chat.
cover the arrow with chat. You're right.
Good job.
Um, so as you're doing that, just so wherever you are, bring health into your transition area, throw that into the chat. Remember that all transition has steps. Nobody gets there without moving through the steps. And I'm just going to put this up for a minute as we look at some of the questions. We ask that you do take a little bit of time for a little bit of feedback. It's very short. And so let's get to the chat.
Yes, let's get to the amazing questions.
Okay. Were you able to understand all about this healthcare stuff at 18, decision making, or did you come to understanding later in life? Did you know the details of your healthcare? Um, or did some of those things happen later?
Most of it took time. And again, I didn't start the transition process until I was around 14, 15. So I did have a very good understanding of what I was looking for in a doctor, what to discuss with my doctor, and everything at 18. But it is still always going to be a constant learning process. And all I can say is just keep pushing forward and keep teaching the young adult and teenager the tools and everything needed. Make sure they understand what they need to talk to their doctor about and what you feel like you need them to prioritize with their doctor.
Absolutely. And there's some youth that guardianship at 18 is the best, the safest,
Mhm.
the correct choice. For other youth, looking at supported decision-making agreements, which come back for that Transition Talks Tuesdays, but trying to put supportive agreements in place as they continue to grow and develop from 18 to 26 to 27. They will learn, they will develop. We try to keep them safe. There's other ways to do that besides guardianship.
Yes.
Guardianship is hard to reverse, um, but you don't have to do guardianship right at 18.
No.
Someone who, maybe you could support them and you put other ways to place through
Hmm.
21, 22, and let's say you've tried everything and they're still not capable of making their own healthcare decisions. You can start the guardianship process then.
Yep.
But maybe their brain will continue to develop. They'll have more experiences. They'll have more opportunities to make decisions. They'll become more of a self-advocate, and support decision making could be something that they can do for the rest of their
Yep.
life and not need
Yep.
guardianship.
And
Everybody's different.
I would definitely recommend writing notes and everything for the young adult in question about what you see is happening with their health and then comparing it to what they think is happening with their health.
And so we have a comment from Lynn that 14-year-old broke the arm. Lots of practice checking in with appointments, I am sure.
Yep.
She talked about preparing for the appointments on the way, how it went on the way home, probably what are you going to say to the doctor, what are your concerns? But yeah, and then prescriptions and insurance, it is a
It is a
gradual
gradual
learning
thing.
process, and that's why we want to repeat and
Yep.
build that whole sense of
I was actually
scaffolding.
more interested in the next question
Mm-hmm.
and everything with
Go for it.
introducing this information to eighth graders with special needs parents. I would say yes, but on the easier scale, wherein it is primarily mostly just the websites like Transition and all the ones for health that you saw in the slides and will be getting and everything with the slides when we email it out and everything would be the information that I would recommend for the parents to look at first and hold a discussion on that before doing anything else and everything and just trying your best with them because sometimes parents will have major pushback on some things or their own suggestions, or they may read stories about the negative sides of the healthcare and everything. So it is primarily just keep trying your best on what information you have available and introducing it in small doses enough for
Yeah.
the parents to make their own opinion. And everything is what I personally would recommend.
Yeah, and I agree. And I would look at the time that we have in high school. Is it learning how to identify how my body is feeling? When is my body feeling great? When is my body starting feeling not so great? And then when am I out and out sick? Is learning that body awareness, and the same with our mental health. When am I having a great mental health day? What's going on with my good mental? When am I starting to maybe slide a little bit down? That whole the more and the earlier we can help our students be self-aware of their bodies, of their strengths, as well as their differences of their bodies, the
Mhm.
better off they're going to then be able to access healthcare,
Yep.
mental health, and physical health. So looking at this is my body, this is how my body works differently. These are maybe introducing, these are the medications that I take to help my body work well. But even in eighth grade, that is when they can start to check themselves in at appointments. They can come up with a list of questions for their doctors. They could request time alone with the doctor,
Mhm.
which for some families can be very, very, very scary. But to help that child establish that it's their health care, it's their body, their health care, their doctor. And so they want to be able to have that relationship with that doctor.
Yep.
So remember the three different parts. We're preparing, we're transferring, and then we're in adult healthcare for the rest of the world. We will, rest of the life. We'll send you these slides, including a number of different places we've already talked
Mhm.
about that we have mentioned. We also have recorded many, many Transition Talks Tuesdays. So if you want to hear a different version of this, feel free to go back. You have an whole another healthcare version with Hunter on Transition Talks Tuesdays, but
Or other
also
specialists and
all
everything are
right.
part of these as well.
Oh my gosh, all sorts of transition topics.
Mhm.
There's the contact information, and in case you missed it, there's the feedback again, but we'll get those slides out to you. Okay,
Yep.
we're going to stop sharing and bring everybody back in. We're right almost at time. Rebecca, closing thoughts.
I just really appreciate all the information the two of you shared, and it was very entertaining, just like I expected. So, thank you for all that. It's a piece that we don't typically give enough attention to, so and it's a very important one. So, thank you for everything you shared, and I appreciate the questions that people were asking too. So,
Yeah,
again,
appreciate the interaction.
Mhm. And
yep.
again, thank you everyone for taking their time out on a Tuesday evening to see my amazing dad and listen to me.
Absolutely. We hope Hunter may not be here, but we hope you all will come back March 3rd when we'll be talking about the post-secondary transition plan. What's its purpose and how can it help us plan our students plan for the future and make changes and choices in high school to help us be successful as adults.
Mhm.
So thank you so much for being here. Really appreciate it. We'll get the recording, the resource sheet, as well as the slides out to you, hopefully before the end of the week. Thank you so much. Have a great night.
Bye, everyone.